Hi, this is Dr. Janowski of Sonata Laser Aesthetics. Today, what I want to accomplish with this video is to take the fear and the mystery out of lasers. Everybody seems to be afraid of getting a laser because they think it's going to take a long time to heal, they think it's going to hurt, they're just worried about it, and as a result, a lot of people who really could benefit from this device just don't do it, they forego it, and it's unfortunate that people believe that. So what I want to show today is I'm going to show a patient getting this laser procedure, and also we're going to do some follow-up and see how long it takes to recover. What I'm going to do is something called a laser peel, which is a low-energy laser procedure that really doesn't take very long to recover from. Yes, it's true, the typical laser will take 1 to 2 weeks. Now we're talking about somewhere 3 to 5 days. It requires very little in the way of pain control. We're just going to put some numbing cream on our patient, and you're going to see how quick this goes. It's going to take maybe 5-10 minutes tops to do the whole procedure, and she'll recover very easily from it. She will benefit from improved texture and improved color. So hopefully this will encourage you guys to try getting a laser peel and not be afraid. Okay, so we're going to start the procedure in a minute. Jessica is ready for the procedure. All she got was a little bit of topical numbing, so you feel a little bit of numbness on the skin. No other medicines, no Percocet, no Vicodin, no Xanax, none of that. It's really not needed for this type of procedure. And the procedure will only take a few minutes, maybe 5-10 minutes tops, and then we'll talk to her after that. Okay, the time is 5:48. We're going to get started right now. How's that feeling? Does that hurt?
No, it made me jump.
Okay, does that hurt?
No.
Okay, so the time is 5:58, so it took me exactly 10 minutes to complete this procedure. Jessica did it with just a topical numbing cream, nothing else. Hold on a second. So the time is 5:58, it took me exactly 10 minutes to complete this procedure from start to finish. Jessica just had a topical numbing cream, no other medications. And so, Jessica, I just want to ask you, you just finished the procedure, tell me how it felt, how did it go?
I would say that it's pretty simple. It feels a little bit warm at times, and some areas are a little bit more sensitive than others, but overall it seemed like a pretty easy procedure, and it was quick.
Okay, and so on a scale of 0 to 10, 10 being a lot of pain, 0 no pain, where would you rate
I would
it?
say that it was sometimes uncomfortable or a little bit discomfort, but it wasn't painful. It was something that was very tolerable.
So we'll give you
So
a number.
easy at 2.
2, so 2 out of 10. So we're going to follow Jessica through her recovery, and you're going to see how quickly it is to recover from this procedure, and we'll follow her up each day as she follows up with us, and we'll check in on her. Okay, so we're 24 hours out from our procedure. We did the laser peel yesterday, and Jessica's here for her first follow-up. And as you can see, the pigmentation on her skin is coming out to the surface. This is exactly what we want to see. She has a bunch of brown spots from sun damage. She's an outdoor athlete, so we expect to see this pigmentation coming up and then eventually falling off. So it's getting ready to do that. So this is actually a perfect result. We see just a very mild amount of inflammation for 24 hours. This is very little. She's just a little bit of redness, and we did give her a steroid cream to help reduce the inflammation when she went home. So I just want to ask you, Jessica, tell me about your experience over the last 24 hours.
So I would say that last night when I was driving home, I did use cold compresses as well as throughout the night, and the swelling in my eyes was something that the doctor prescribed some steroid cream for this morning, which was very helpful, and I was able to go to work today, and the swelling has continued to go down over the course of the day.
Okay, and what's your level of pain or discomfort right now?
I would say there is some sensitivity around my eyes, but the rest of my face feels almost back to normal, just feels tighter than normal.
Okay, and did you go to work today?
I did go to work today.
Okay, great. So what Jessica was referring to is when we do the eyelids, not the eyes, but the eyelids, to get some tightening from on the lids, we get a little bit of swelling for about a day. You don't have to do the eyelids if you don't want to. If you want to see some tightening, we go ahead and we treat that. And then we give some mild steroid cream to help with the inflammation, cold compresses and things like that. But she's already on her way here to healing from this procedure very quickly, and we'll continue to follow her over the next few days, and we'll see her skin start to clear up and look terrific. So we'll follow up tomorrow. Okay, so now we're 2 days after the procedure. Jessica's come back for her follow-up, and we're just checking up on her. You can see there's still some redness and inflammation, but there's much less swelling, and Jessica's reporting less swelling than there was before. Pretty much back to normal in terms of the swelling. So tell me, Jessica, how things have gone over the last 24 hours.
I would say the swelling has gone down significantly, and that I've been able to function normally in things I like to engage in, like working out and work, etc.
Okay. And how much pain do you have right now?
I would say I have a small amount on my eyelids, but the rest of my face is just tight. There's no pain in the rest of my face.
Okay, good. And so like I said, eyelids are optional. You can do eyelids if you want to see some tightening in the lids, if you're willing to put up with a day or so of the swelling and a little bit of tenderness there. All the other areas heal much more quickly. So she's doing really well. Probably over the next day or two, she's going to start to get a little bit of peeling going on. The redness will come down significantly, and she'll be healing up pretty soon. So we'll check up on her in a day or two. Okay, so now we're a week out after our procedure, and Jessica's doing great. You can see her skin is really clearing up nicely. She just has a little bit of residual pinkness, which is easily covered with makeup, and a little bit of thickness to the eyelids from a little bit of swelling that's almost gone. So she's doing real well, and a lot of her pigmentation has really improved. So just tell us how you're doing today and how things are going.
My skin is definitely a lot smoother, and I can tell that a lot of the pigmentation from aging has been minimized. I think that with some light use of Aquaphor throughout the day, that it's just a little bit dry, but it gets better every day.
Okay, and you're back to doing your usual activities?
I don't think I ever stopped.
Right, she's very active, and she really it didn't slow her down much, even during the whole healing process. So we're going to post her before and after pictures so you can see in more detail, what things look like after this procedure. And so please consider the laser peel. It's a wonderful procedure that will help pigmentation and make the skin smoother and tighter. So Jessica's completely recovered from her laser treatment. Jessica, tell us how your experience was and how you feel about your results.
So I'm about a month out after the procedure, and I feel like my face is more clean. It's a little bit tighter around my eyes, and I'm happy with the results.
Good. And you feel like it was a worthwhile treatment?
Absolutely. I think, like I said, my face is a lot cleaner. It feels a lot brighter. I don't have a lot of the old pigmentation that I used to have in my face, so it's definitely worth it.
And how did you find the whole process in terms of tolerability and recovery?
I think that the recovery process was short in duration, but also the medical staff here was really helpful in making sure I got the support I needed when I had questions.
Okay, well, I appreciate it. Thanks a lot.
Thanks.
Okay, so we're here with Jessica. She's completely recovered from her treatment. She's about a month out, and we're just following up to see how everything went. So Jessica, tell me about your experience and how you like the procedure.
I think right now my face is probably the clearest it's ever been, and I have a lot less age spots, as well as, I don't even really feel like I need to wear foundation right now. I feel like my skin's a lot brighter and cleaner and clearer.
Great, fantastic. That's our goal with everyone with this procedure. And in terms of your recovery process and just going through the whole process, how did you find that?
I think it's pretty short in duration, especially for the results that you get. I think that, it's well worth it.
Great. And I remember that you basically worked through the whole recovery process, and you just didn't let it slow you down?
No, I didn't let it slow me down, whether it be for work or physical activity. I was able to pretty much engage in all aspects of my life.
Okay, well, we appreciate your feedback, and thanks very much.